And when you look at the bacterial toxins and inflammatory compounds, there's something called TMAO, trimethylamine oxide, which comes from the carnitine, choline, and cholesterol that is consumed in the diet. Carnitine and choline in red meat, poultry, eggs, and fish and dairy is converted by gut bacteria into a toxic compound called TMAO, trimethylamine oxide, that increases risk for cardiovascular disease, stroke, and cancer. Vegan and people on plant-based diets do not harbor the strains of bacteria that convert choline or carnitine into the disease-causing TMAO. So not only are people on a plant-based diet, do they have lower levels of choline, they have enough, again, to stay healthy, but not so much that they create this disease, but they also don't have the bacteria that catalyze the formation of the TMAO. Habitual consumption of choline and carnitine-containing animal foods by individuals with the TMAO-producing bacterial strains has been shown to significantly increase risk for cancer, cancer-related death by promoting the development and spread of early cancer. Moreover, microcystins from blue-green algae blooms have been found in fish, shellfish tissues, have also been linked to increased risk for liver cancer, and another algal toxin, BMAA, has been linked to increased risk for ALS or Lou Gehrig's disease, amyotrophic lateral sclerosis, Parkinson's disease, and also Alzheimer's diseases. Now, this graph on the left shows you the amount of hormones found in an 8-ounce glass of milk, and you can see there's 176 nanograms of actual estrogen, as well as 78 nanograms of cortisol. Over the lifetime of Western women, her estrogen exposure is therefore 4 times greater, assuming she's eating meat and dairy products, and that means her breast cancer risk is 5 times greater than women living in rural China who don't consume dairy products. And when you look again at milk and breast cancer as a function of per capita intake, those countries with the highest intake of milk also have the highest risk of breast cancer. A recent study of over 53,000 North American women that was conducted over an 8-year period, published in the International Journal of Epidemiology, showed a marked increase in breast cancer risk associated with milk consumption. Consuming as little as 1/4 to 1/3 cup of dairy milk per day was associated with an increased risk of breast cancer by 30%. If you increase that to 1 cup of milk a day, the risk went up to 50%. And for women drinking 2 or 3 cups per day, the risk increased by as much as 80%. Dairy product consumption is also the leading risk factor for prostate cancer. Harvard health professional studies showed that men who drank more than 2 servings of milk a day had a 60% increased risk of prostate cancer. Exposure to both natural and synthetic hormones in dairy products and increased production of IGF-1 in the liver because of dairy and animal protein consumption has been linked to increasing risk for breast and prostate cancers, as well as testicular and uterine and ovarian cancers. The lactose in dairy products has also been linked to a higher risk for pancreatic cancer, ovarian cancer, and testicular cancer. And this looks at skim milk and prostate cancer, showing it's not the fat, it's the milk itself that is the problem. And this looks also at milk and uterine cancer, again, showing a direct correlation. The more milk consumed on a per capita basis, the higher the incidence of uterine cancer. Now, these slides are from Dr. Jackie Bussey, who is a board-certified pediatrician and a fellow at the American Academy of Pediatrics, and she shows the growth rate of cows versus humans, and you see that cows go from birth to adult size in about 2 to 3 years, whereas humans take up to 20 years. And milk is not a food. Milks are specialized materials that are designed for the specific species for which that mother is secreting that milk. And cow's milk is very intensively growth promoting because cows grow much faster than humans. When humans ingest this material, it promotes diseases. So when you look at milk-driven growth patterns, again, this is Dr. Bussey's slide, you can see that over on the right, this is a look, a graph that looks at the increase in size in babies and mothers who drink milk during pregnancy. And again, what you see is that women who drink milk tend to have much larger babies, which increases the risk for all sorts of problems, including vaginal tearing, urinary incontinence in the mother, and also health problems in the baby themselves. It's not normal or appropriate. Kids who drink milk also grow bigger and faster, and this accelerated growth results in increased disease risk. And that's due, again, to this mTOR activation. We already discussed how these were genes that govern growth and development in young animals. So again, not something that humans should be consuming. And this is another video discussing dietary cholesterol and disease risk.
In 1969, a correlation analysis performed by a Dr. Greger, no relation, and he spelled it wrong, found this rather tight correlation between animal protein intake in countries and intestinal cancer mortality. In the 70s, this relationship was extended to breast cancer too, and animal fat implicated as well. But it all kind of travels together in the same foods, along with dietary cholesterol. And there's a significant correlation between high consumption of cholesterol-containing food items and the worldwide distribution of colon cancer as well, a large and highly significant correlation even after controlling for other dietary factors such as animal fat and fiber, supporting the possibility of a cause-and-effect relationship between cholesterol intake and colon cancer. So is dietary cholesterol co-carcinogenic for human colon cancer? Let's find out by feeding some to rats. Inject rats with a carcinogen, and cholesterol-eating rats get tumors in half the time and all die off, whereas most of the cholesterol-free group survives. But the relevance of animal data to the human situation is debatable. How would the cholesterol and cancer link even work? Well, we don't need to consume any cholesterol, since our body makes all that it needs, and when we do consume extra, there's a limit to the amount of cholesterol the body can absorb. So where does the excess go? Down to our colon. And so the cells lining our colon, where colon cancer arises, are therefore constantly exposed to fecal cholesterol. Should a cancerous or precancerous polyp arise, maybe all that extra cholesterol would help it grow faster. The amount of cholesterol we eat could thus be a factor determining the rate of development, growth, or spread of such a tumor. This was all just kind of speculation back in the 70s, but they realized that if it were true, that would be good news, since a low-cholesterol diet, cutting down on meat, dairy, eggs, and junk, the only foods that really have cholesterol, would be a feasible, cheap, safe way to help prevent and treat colon cancer. So, what's the 40-year update? Country-by-country correlation can never do more than just inspire studies like this, the largest nationwide population-based case-control study to date to assess the association between cholesterol intake and several types of cancer. And they found dietary cholesterol intake was associated with increased risk of cancers of the stomach, colon, rectum, pancreas, lung, breast, kidney, bladder, and bone marrow, non-Hodgkin's lymphoma. So the flip side is that a diet low in cholesterol may play a role in the prevention of several cancers. What does that mean food-wise? Cutting down on meat, dairy, and eggs, which may increase risk of cancer, though eating diaries would probably just increase risk of paper cuts. Lots of fiber, though. The findings of this study should essentially be viewed as an indication that diets rich in meat, dairy products, and eggs is an unfavorable indicator of the risk of several common cancers. Two cancers they didn't look into, though, were endometrial cancer and throat cancer. Put all the studies on cholesterol consumption and the risk of endometrial cancer together, cancer of the lining of the uterus, they found a dose response, meaning more cholesterol consumption associated with more cancer, 6% for every 100 milligrams extra a day. So, like a daily omelet, might increase cancer risk by about 20%. Maybe because the extra cholesterol is converted into estrogen, or it may just be the increased oxidative stress reflected in higher levels of oxidized cholesterol. I talk about that in my Alzheimer's series. There also appears to be a dose-response relationship with pancreatic cancer, one of our most dismal malignancies. The compilation of studies found the risk increased by 8% for every 100 milligrams of cholesterol, so that would be like 30% higher risk of pancreatic cancer for a daily omelet. And finally, throat cancer. Increased risk was observed for elevated cholesterol intake, about 85% higher odds, consistent with the other studies. Yeah, maybe it's the oxidation, but maybe it's the inflammation. However, we can't be sure it's the cholesterol itself that's to blame. Elevated cholesterol intake could just be a stand-in indicator that a diet rich in meat, eggs, and dairy products may have unfavorable effects.